Welcome to Nursing School Explained. In this video on the focused cardiovascular assessment. Remember that we still always follow the assessment in the head to toe fashion, but when we focus on the cardiovascular system, not only do we assess the heart sounds with paying attention to all the different cardiac landmarks, but we also have to assess the peripheral pulses, which include the epipulse in the upper as well as lower extremities, as well as the carotids and the abdominal and perhaps even the renal arteries to assess for bruits. So let's take a look at how this is done. Hi, how are you today?
I'm all right.
My name is Petra. I'll be your nurse. I'll do your assessment right now. Is that okay?
Yeah.
Okay, so let me do some hand hygiene here. Can you tell me your name?
Steve Jones,
And what year is it?
2022.
Where are you at right now?
I'm at the hospital.
And what brings you in?
Sometimes my heart feels like it's racing.
Okay, so we'll focus on checking out your cardiovascular system here in more detail. But first, I'm going to shine a bright light into your eyes. Look straight at the tip of my nose, please. And now the other side. Good. Open up. Okay, stick out your tongue. Good. Now I'm going to palpate your carotid arteries here. So let me find them. Might just be a little bit uncomfortable. And now the other side. Okay, good. Now I'm going to listen to your neck arteries here. And in order for me to hear better, I'm going to ask you just to take a deep breath and hold it when I'm ready, okay? Take a deep breath and hold it. Okay, exhale. Take a deep breath and hold it. Okay, good. Breathe. Thank you. So next I'm going to listen to your heart. So I'm going to lower your gown. Just breathe nice and normally here, okay? Okay, good. So next I'll listen to your lungs. Every time I touch my stethoscope to your skin, please take a nice deep breath in and out through the nose. I also need to listen to your back. Is it easier for you to sit up or to roll towards your side?
Sitting up's hard.
Okay, so I'll have you roll towards me then, please. Here we go. And the same thing. So I'm going to put my stethoscope on your skin. Every time I do that, please take a nice deep breath in. I see you have a little redness there. Okay, that's nice and blanchable. We'll make sure we put a pillow behind you to offload you. So nice deep breath. Can you roll just a little bit more? Thank you. And one more. Good. Okay. Go ahead, let me just take a look at the rest of the skin. Okay, go ahead and roll back onto your back, please. We can slide your gown back up. And next I'm going to look at your abdomen here. And first again, I'm going to listen to one of the major blood vessels here. So just breathe nice and normally. Okay. And now I listen to your bowel sounds. Just again, nice normal breaths. When was the last time you had a bowel movement?
This morning.
Okay. And next I'm going to palpate here. Let me know if you feel any tenderness. So far so good?
Yeah.
Okay, I'm going to press a little harder now. Let me know how that feels. Any pain?
That's okay.
Okay. And your bladder is not distended. Okay. Then let me go ahead and check your upper extremities. Can I see your hands here on both sides? Can you squeeze my fingers as hard as you can? Thank you. Let me check your circulation here. Other side. Let me check the rest of the fingers over here too. Okay, and I'll check your pulses. Good, they're nice and strong and equal. And now your brachial pulses. Okay, excellent. So next I also need to assess your femoral pulses, which are kind of like in the groin crease. Is that okay?
Yeah.
All right, so I'll just keep you as covered as I can here. And let me see the other side. Very good. So let me cover you up here and I'll move on and assess your lower extremities. So let me get you uncovered here. First, I'm going to check all your pulses here. Are you able to bend your knee on this left side for a moment? Thank you. Actually, can you bring it down just a little bit? Great. And now let me check the other one, please. Okay, great. You can straighten your legs. Check your circulation down here. Please push down against my hands like on a gas pedal. Pull your toes to your nose. Okay, great. And then let me have you bend your knee, kick out against my hand here, and pull back. Great. Relax. Let me see the other one. Kick out against my hand and pull back. Great. And now I'll assess for some swelling down here. So a little pressure on your shin. And the other side. Okay, that's it. We're all done. Thank you for watching this video on the focused cardiovascular assessment. Please also make sure to check out the other assessment videos in the physical assessment playlist that go over different body systems when the patient is admitted with a certain problem that focuses on a specific body part. Thanks for watching Nursing School Explained, and see you soon.